research nurse for the intensive care unit at King's College Hospital. When I did my nursing degree, it was very heavily research focused. Everything that we learnt was evidence based. Then when I started my intensive care nursing, my actual job, it's all founded in evidence based. We have to do an intensive care course to be able to become specialist nurses, and we have to rationalise every clinical skill that we do and how we treat our patients. It's all underpinned by research. It made me really sort of get a feel for the fundamental importance of research in developing intensive care, and how much it's progressed is all related to the research that people do. So that gave me a real thirst for it, but then I moved into a research nursing post, and I saw when I went into my nursing research job that there were huge gaps in knowledge, and I started having ideas of things that I could do myself, and I was encouraged by my colleagues to progress with some area of research. And with the clinical research lead for intensive care, with his idea, we then formed this brilliant concept which really focused on pioneering nurse research, but also research about nurses, which there's just not enough out there. And I wanted to be another voice, and a strong voice for nursing research. Because my PhD is focused around ultrasound, I learnt ultrasound through some of the doctors at work and have had brilliant support and supervision from them. Having supervision, being supervised by doctors is quite a big step, because you're then I was having to do teaching sessions and presenting my cases in a room full of doctors, which is hugely daunting as a nurse. So it was taking that step to right out of my comfort zone to try and be more confident and trust my knowledge and trust my skill set, which is in an area that nurses don't normally work in. So that was a huge step forward, but really enhanced my skills. I also I was awarded a travel fellowship with the Winston Churchill Memorial Trust, where I went and learnt from nurses. They're the only ones of their kind in the whole world that actually perform ultrasound as a role. They're with a background of intensive care nursing, and I spent 2 months with them learning advanced echocardiography in Australia, which was a phenomenal experience. And they were the most inspiring nurses to work with because of their breadth and depth of understanding of such an advanced clinical skill. It was fascinating going to echocardiography meetings where they would present cases, and they would always ask the nurses advice because they were more experienced than the doctors were. So really getting to grips with such an advanced clinical skill, but knowing that we as nurses can do it. It's not just confined to doctors. We've got the same hands, so we can perform the same skills. I struggled at the start. I found it hard to take time off for myself when there is always work to do. But I've had some health issues recently, and I think it's made me take a step back and really realise what's important. Obviously the work is always going to be there, and there will always be work to do, but you're never going to be able to get it done if you haven't got the energy to do it. Getting rejected from my first attempt at the doctoral research fellowship application, that was hard. When I got rejected the first time, I got really extensive feedback on my application. So you have an application process and an interview process, and I just got to the application stage. I didn't get to the interview stage. They gave me lots of detailed feedback on where I'd fallen short on my application. They focus on the 3 Ps, the person, the project and the place. So just seeking out that kind of help and that guidance. That's what I did. I spent another sort of 6 to 8 months, I think, between my 2 applications, really refining my application in all those 3 areas. I was lucky enough my second time around to actually be offered the doctoral research fellowship, so it is worth putting the time in and to persist. You will get there. Speak to as many people as you possibly can. If you have a research department in your hospital, then I would definitely recommend going and speaking to them, seeing if you can get some experience, maybe shadowing them for a week, just to understand really what the processes are of setting up and delivering research. Speak to people further afield as well, people that maybe work in the NIHR. There's a list of people that act as mentors for fellows that like me, and people that are doing the pre-doctoral fellowship as well, that would be happy to speak to you. I would love for intensive care nurses across the country to have a training programme available to them to perform ultrasound, and for routine ultrasound to be performed as part of patient assessment by nurses across the country. I would also like to focus on interprofessional ultrasound as well across physiotherapists, advanced critical care practitioners, and create a communication platform between them but with doctors as well, where they have this shared understanding and a shared language of ultrasound, where they can share their findings and communicate on the same level as each other to ultimately benefit patients. At the moment, it's predominantly doctors that undertake research. I think also historically, it's this focus of what scientific question can we answer without really understanding whether what this research finds really benefits the patients, or asking the patients if it's something that they would want to happen to them. Focusing on nurse research, who are a huge proportion of the NHS workforce, it actually brings an entirely new perspective to research. You can focus on those scientific questions, but you have got a real understanding of how patients interact with the healthcare system and how research could genuinely benefit them, but also how the patients and family can be involved in the research process, in the design, in the delivery of the research, in analysing it and understanding it. I think nurses have such a positive spin that they can bring to research that we're lacking, I think, in the world of research at the moment. I think it's just so fundamental to bring that voice to nurses, and to really focus on creating a better environment for nurses to work in by researching nursing in healthcare, but also by delivering nurse research. It gives us a voice. I think working towards academic nurses, which are few and far between at the moment, would change the face of the NHS.